All right, this is a mini consultation all about liposuction, and this is liposuction fat. Liposuction is a surgical procedure and it should be performed by a board-certified plastic surgeon. The purpose of liposuction is to debulk areas of stubborn fat, whether it's under your chin, in your armpit, your belly, saddlebags, etc. And going into surgery, you should be as physically fit as possible, healthy enough to undergo a surgical procedure, and as close to your ideal weight as possible. Liposuction involves removing fat cells from under your skin, and they're gone permanently. It's pretty amazing. You have a superficial layer of fat, and I usually show pinch over your sternum, that's your superficial layer of fat. We stay out of that layer. Underneath your superficial layer, you have your deep layer of fat. And the purpose of liposuction is to debulk that area so you have a nice, smooth, continuous layer over your body surface so you can appreciate your natural curves and your natural muscle tone underneath. Liposuction is performed either under local anesthesia in the office, for instance, smaller areas. We can do it with you awake. Or if we're doing several areas at once and we need to go to the operating room, and it's a short trip to the operating room as an outpatient procedure. For any one area of fat, we need to target it from several different areas. So we make 2 to 3 millimeter incisions. They're hidden in body skin creases as much as possible. We inject a solution into the area. It contains normal saline, so it helps to puff the area up. Epinephrine, that will constrict the blood vessels, so there's no bleeding during surgery, and it minimizes bruising, although you still will have a little bit of bruising. And lidocaine, which is a local anesthetic. So when you wake up or after the procedure, you're basically numb. After the numbing wears off, you'll be a little bit sore, so we will give a prescription for something for pain, but generally you'll be on Tylenol after that. By way of those little incisions, we insert a blunt-ended wand, which is called a cannula, and we permanently remove fat from the deep layer. So you have one little collection, we want to bring it down, and then we feather it out to the surrounding areas. Afterwards, we put a small dissolving stitch in those incisions, a waterproof dressing, and then patients will leave the office or the operating room wearing a compression garment. So kind of like a Spanx type garment or an abdominal binder. That will prevent the swelling from getting out of control. It will limit bruising, and it will also encourage the skin to mold to its new form. Once those fat cells are removed, they're gone permanently, and that's why liposuction is so amazing. Did you know that you're only born with a certain number of fat cells? And after age 14, they can no longer multiply. So when one fat cell dies, it's replaced by another one. When we permanently remove those fat cells, you essentially have less fat storage capacity. And as long as you maintain your current routine, your regular diet, exercise program, the results are permanent. If you gain weight, you tend to gain it everywhere. Some of those fat cells will increase to store that extra energy that you took in but you didn't burn off. And if you lose weight, you tend to lose it everywhere. But liposuction is not a license to go nuts and do whatever you want. It's really an investment. So going into liposuction, you should be as fit and healthy and active as possible. That's the time to pass the baton to someone like me to do some additional body contouring. For more information, please visit my website, drkarenhorton.com. I have written an entire page as if we're going through a consultation with the most frequently answered questions, and I have several blog posts about liposuction as well. Thanks for tuning in. It's pretty amazing.